Hello, and welcome to Let's Talk, the space where we delve into the conversations that matter. Today, we're tackling a topic that affects millions worldwide, yet is so often shrouded in silence and misunderstanding: the stigma of addiction and the journey of recovery. This isn't just a conversation for those who have personally faced addiction. It's for their families, their friends, their colleagues, and for society as a whole. Because the way we talk about addiction, the way we perceive it, can either be a barrier to healing or a bridge to hope. In our episode today, we will explore the pervasive nature of stigma, dissect the realities of what it means to be in recovery, and, most importantly, discuss how we can collectively dismantle the invisible wall that prevents so many from seeking the help they deserve. So, what exactly is stigma when we talk about addiction? It's the negative attitudes and beliefs about people who have substance use disorders. It's the judgment, the stereotypes, and the discrimination. And it has a real and devastating impact. According to the National Institute on Drug Abuse, this stigma is a significant barrier to individuals seeking and receiving the treatment they need. Imagine feeling like you have a disease, but being too ashamed to seek a doctor's care for fear of what they or your community might think. That is the reality for countless individuals. This stigma manifests in a few key ways. Public stigma. This is the general societal disapproval of people with substance use disorder. It's the harmful language we hear, words like junkie or addict, that reduce a person to their disease. It's the misconception that addiction is a moral failing, a lack of willpower, rather than what it truly is: a complex chronic disease of the brain. Self-stigma. This is when individuals with a substance use disorder internalize these negative public attitudes. They begin to believe the stereotypes about themselves, leading to feelings of shame, hopelessness, and worthlessness. This can be one of the most significant barriers to recovery, as it can prevent someone from believing they are worthy of getting better. Institutional stigma. This occurs within systems and organizations. It can be seen in healthcare, where some professionals may not treat individuals with addiction with the same level of care and empathy as those with other chronic illnesses. It can also be present in the workplace, making it difficult for those in recovery to find stable employment, or in the legal system, which has historically criminalized addiction rather than treating it as a public health issue. The consequences of this multi-layered stigma are profound. It isolates individuals, tears families apart, and tragically, it can be fatal. When people are afraid to reach out for help, they are more likely to suffer in silence, increasing their risk of overdose and other health complications. Now, let's talk about recovery. Because of the stigma we've just discussed, the image of recovery is often skewed. It's not a straight line. It's a journey with ups and downs, successes and setbacks, and it's a journey that looks different for everyone. Recovery is not just about abstaining from a substance, it's about healing the whole person. It involves addressing the underlying causes of addiction, which can include trauma, mental health conditions, and environmental factors. It's about learning new coping mechanisms, rebuilding relationships, and finding a new sense of purpose. It's crucial to understand that relapse is a part of the recovery process for many. Just as a person with diabetes might have a spike in their blood sugar, a person in recovery might experience a return to substance use. This isn't a sign of failure. It's a sign that the treatment plan needs to be reevaluated and adjusted. We need to view relapse not with judgment, but with compassion and a renewed commitment to support. The path to recovery is multifaceted and can include a variety of approaches such as therapy and counseling to address the psychological aspects of addiction, medication-assisted treatment, MAT, the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. Support groups like Alcoholics Anonymous and Narcotics Anonymous, which provide a community of peers who understand the challenges of recovery. Holistic therapies such as mindfulness, yoga, and art therapy, which can help in managing stress and promoting overall well-being. The most important thing to remember is that recovery is possible. Millions of people are living full, productive lives in recovery. Their stories are a testament to the resilience of the human spirit and the power of compassionate support. So, the big question is, what can we do? How do we break down this wall of stigma? It starts with each and every one of us. First, let's talk about language. Words have power. Instead of saying addict, say a person with a substance use disorder. This is called person-first language, and it emphasizes the person, not the disease. Instead of clean or dirty to describe sobriety, we can say a person in recovery or a person who is not currently using substances. This simple shift in language can have a profound impact on how people are perceived and how they perceive themselves. Second, let's educate ourselves and others. Understanding that addiction is a disease, not a choice, is fundamental. Share accurate information. Challenge stereotypes when you hear them. Encourage open and honest conversations about addiction in your families and communities. Third, let's offer compassion and support, not judgment. If someone you know is struggling, let them know you are there for them. Listen without judgment. Help them find resources. Your kindness and understanding can be a powerful catalyst for change. And finally, for those in recovery, sharing your story when you feel ready and able can be an incredibly powerful tool. Personal stories humanize the issue and show that recovery is not just a concept, but a lived reality. The stigma surrounding addiction and recovery is a formidable opponent, but it is not invincible. It is a wall built brick by brick with misunderstanding, fear, and judgment. And it can be dismantled brick by brick with education, empathy, and open conversation. Let's choose to be a society that lifts people up, that offers a hand to those who are struggling, and that celebrates the courage and resilience of those on the path to recovery. Let's be the generation that replaces stigma with support and shame with hope. If you or someone you know is struggling with a substance use disorder, please know that you are not alone and help is available. Here are a few resources. The Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline, 1-800-662-HELP, 4357. This is a free, confidential, 24/7, 365-day-a-year treatment referral and information service. The National Institute on Drug Abuse, NIBO, you can find a wealth of information on their website at drugabuse.gov. Local support groups. A simple online search can connect you with local chapters of Alcoholics Anonymous, Narcotics Anonymous, and other support networks. Thank you for joining me on Let's Talk. But the conversation doesn't stop here. Let's continue this conversation together in the comments below. Sharing your thoughts and experiences helps us all learn and grow. Together, we can break the silence. Together, we can change the narrative. If you found this video valuable or it resonated with you, please give it a like to help this important message reach more people. And to ensure you're part of our future conversations, make sure to subscribe to the Let's Talk channel and hit that notification bell so you never miss an episode. Every like, comment, and subscription helps build this community of support and understanding. Thank you for being a part of the change. Let's keep talking.